Hello, and welcome to Voices in African Health. This is a podcast where we explore the big questions shaping global health and connect them to realities across Africa's health systems, hearing directly from the people driving change. I'm your host, Sharon Quntai. Today, I'm delighted to be joined by Mark Chataway, a global health expert with decades of experience working with governments, multilateral organizations, and companies worldwide. Mark has been deeply involved in conversations around global health architecture, and we'll be talking about Africa's place within that evolution. Hi, Mark. Welcome to today's episode.
Thank you, Sharon. You make me sound even older than I am. But it is true. I was telling you earlier that my first visit to Nairobi was 1989, so I must be quite old. But anyway, yes.
Not really, but thank you. Thank you, Mark, so much for joining us. To start us off, I think we could first start with an introduction of yourself. Tell us a little bit, especially for our listeners, about your background and experience in global health.
So I started out as a journalist, got interested in health, and had my first job in health during the HIV epidemic in the US. And that kind of led logically into global health, if you will, because we started out thinking that HIV was a problem of the US and maybe Europe. And it soon became clear that it was a much bigger problem in Africa. And therefore, I started to become interested in global health. And I've been working in various aspects of global health, a lot in reproductive health, sexual and reproductive health, a lot in NCDs. Since the 1990s.
Right. That's quite the experience, Mark. And for us to just go into the questions, from your perspective, how has the global health architecture evolved in the recent years? And where specifically does Africa currently sit within that evolving landscape?
So I think it's probably evolved badly in retrospect. I mean, hindsight's always 2020, right? But what we have encouraged Africa and other emerging economies to do is replicate the systems in the US and Europe largely. So we've made some concessions. We've instituted community health workers, or we've instituted nurse-led services, which are, by the way, models we are now re-importing to Europe because they work so much better than our own health system.
Right.
So the UK has Brazilian community health workers using Google Translate to train British community health workers in the hope they can achieve the same kind of results that are achieved in Brazil. But I think overall, we've made a fundamental mistake because our health systems are not very good. And they're certainly not very efficient. And paradoxically, we've got to the point where the least efficient health system in the world, the US, is holding itself out as a model to countries such as Africa.
Yeah.
And because they've been giving a lot of the money, it's been US institutions and US models that have predominated, and it's produced the results it produces in the US, which are very expensive and not very good.
That's quite a great overview and a lot to think about. So let's bring it also now closer to specifically to the Africa's role in shaping the agenda. So do you see Africa beginning to shape global health agendas, or based on your answer, actually, is it still more of one of the countries or one of the continents where decisions are made elsewhere, and then Africa is just more of a recipient?
I think that has been the model. So we all tend to think of the cutback in overseas development assistance, the money that comes from Europe and the US to Africa and other emerging economies. There have been a lot of cutbacks. We tend to think of that as a disaster. But someone leading a faith-based health system said to me a few weeks ago, if the Americans called me tomorrow and said, we've made a terrible mistake, we want to go back to the way things were in 2023, I would say, please don't. And I think he's right, because the cutting back of those systems has allowed African innovation, African models, African leadership to evolve. Now, the big question is, will the money follow it?
Right.
I'm convinced Africa can run a more efficient healthcare system than we can, but it can't run it on the funding levels in most African countries at the moment. So all of Africa needs to get up to the share of budget that South Africa even Kenya is spending. I mean, Kenya is doing pretty well in terms of share of budget. Not enough, but pretty well. So the big question is, can other countries come up to that level of spending?
Right. And just to think also around something else that's another topic that's really trending right now around local innovations. So Africa's emerging biotech and the local manufacturing initiatives are really getting a lot of attention now. Do you think that can help us to shift the balance of power to global health, back into global health? Or what role do you actually see for Africa driving the innovation topic specifically?
I think there's a very difficult policy decision to be made. Because if you have policies that encourage biotech innovation, that encourage manufacturing in Africa, they will in the short term, maybe even in the medium term, result in more expensive health products for Africa. You need a protected market because new producers, whether they're Africans or Europeans, can't compete against well-established producers with vast economies of scale.
Yeah.
So that's certainly true in terms of production. And there's a policy decision to be made. And unless Africa is willing to pay more for health goods, then most health manufacturing is not viable. And that's a difficult and unpopular thing to say. But there is no way an emerging African producer can produce at the same cost as a Chinese or an Indian producer.
Yeah.
In terms of innovation, the problem is that there are vast subsidies for biotech innovation given by European, American, Chinese, and to a lesser extent, Indian governments. So Africa probably has to compete against those. It also has to do stuff it's really good at and not try to compete head to head with those established players. So that's probably two things. I mean, it's probably one, infectious disease, because infectious disease remains a big problem in Africa, and it isn't in most of the industrialized world.
Yeah.
And then secondly, it's frugal innovation in NCDs. So we have a route to very complex innovation. I think if Africa can figure out how to do some of that stuff, but do it more cheaply, then there's also a niche there.
Right. And of course, definitely also for innovation to happen, we also depend a lot on partnerships as well. So looking ahead, it feels like partnerships are going to be really important for Africa's health systems. What kind of collaborations, whether with global agencies or private sector players, or even within Africa itself, do you think would make the biggest difference here?
So I think there are lots of partnerships that are potentially exciting. The obvious ones are partnerships with global pharmaceutical companies who don't want to have the infrastructure in Africa, but do want to have one foot in what will be an important market of the future. And that depends a bit. I mean, the big publicly held American companies have less luxury to think 30 years ahead than the European family-owned companies like Roche or Merck, German Merck, where the same family knows that they will probably still be holding the shares in 30 years. So they are thinking that far ahead. So I think that's an obvious one. I think then secondly, there are really interesting models of private sector players, African private sector players, who are providing services to lower middle class people, working people at reasonable fees, and sometimes contracting with government. So a spin-off of the Africa Development Bank has just funded a private sector player to provide nephrology services in East Africa. And they're doing that in many places, contracting with either faith-based health systems or the government. So it's using the nimbleness of the private sector to provide services for the whole population on a government tender. So I think that's one. And then finally, there's this enormous resource that Africa has of the faith-based health systems, which have a history of innovation and of nimbleness, but also have a history of transparency, integrity, and cost control.
So speaking of faith-based organizations, what role do you see? I know they're also very much affected by the funding cuts, and we've been seeing a lot of changes even here on the ground based on that. So what kind of role do you think faith-based organizations can play right now in the Kenyan market, specifically for strengthening the African healthcare system?
So I think the faith-based sector has historically not received a lot of overseas development assistance because there is a bias in many of those ODA agencies against working with the faith-based sector. So the faith-based organizations will do very well under the new American global health policy, it looks like. We haven't seen the details, but that's at least the theory. And encouragingly, the US administration has invited organizations they're probably not ideologically aligned with, like Catholic Medical Missions Board and Islamic Relief USA, into those discussions. So that's all a very hopeful sign. I think the Europeans are going to get more flexible. So I think the Europeans have historically, like the Americans, wanted to fund their own organizations, or at least affiliates of their own organizations.
Right.
But I think because there's less money now, they will be looking for efficient ways to spend it. And many of the faith-based groups are exactly that.
Quite interesting to note that. And if we look to 2030, what do you think Africa's place specifically in the global health architecture will look like, seeing all of these changes that are happening?
So I don't know is the short answer. I think there are 2 or 3 open questions. Does the Africa CDC really start to have an important continental role in setting standards, in helping to assure new systems of recognizing and certifying production facilities, licensing medicines, establishing best practice? I think that's one question. And there's big challenges to overcome because, as in anything, there are politics. So I think that's one big question. I think the second question is, can the African Union be more effective than it has been at establishing norms around health spending? And if it can, then that becomes quite positive. And there's an emerging global view, not just in Africa, but a global view, that prosperity without good prevention spending and good treatment spending is very difficult.
Right.
So there's a big incentive to the AU to do that. And I think the African Development Bank, the other development banks active in Africa, are pushing the AU hard in that direction. So that will be the next question. Then I think the role of AI and big data is important. So our initiatives, like the Kenyan initiative to aggregate data at a national level, successful? Is Africa able to move faster than Europe and North America, where vested interests are very threatened by this progress? Is Africa able to move faster to take advantage of those big data and to allow AI to do more and more basic healthcare under human supervision?
Right.
But basic healthcare. And I think the signs are pretty encouraging in that direction. So if the answer to all those is yes, then 2030 is close, but progress is moving so fast, it's feasible.
Right. That sounds very interesting. And especially when you speak around AI, of course, we know that currently Africa is moving really, really fast in terms of adoption. We recently had a paper, specifically a study talking about how Kenya specifically is adopting AI really fast, especially for the young people. So this is something that definitely lots of people need to look into. Of course, there's also the factor that AI can definitely not replace humans. So I totally agree with you. As you say, definitely with human supervision would make more sense.
I disagree with you. It can't replace all humans. It can replace a lot of humans.
Really?
Yeah. And if I were an oncologist in Europe, I'd be very worried. I mean, at my age, I wouldn't, because I'd be thinking about retirement. If I were a 30-year-old oncologist in Europe, I'd be very, very worried. I think the reason there'll be less political pushback in Africa is because even if Kenyan oncologists see 95% of their work disappear, they'll still have more work than they can handle. So I think Africa's better positioned than we are to embrace the speed of that change.
And I think, of course, a lot of us still are struggling to really understand how to use AI well, especially when it comes to health. So I'm seeing a lot of conversations around doctors being taught how to use AI, being trained how to use AI. So I think we'll probably move slower than Europe, as you mentioned. But
I think you may move faster than Europe because
really,
there are so many people who can't get to see a doctor that even though
Yes.
there are risks and there will be mistakes and stuff will go wrong,
Yeah,
it's better than no access at
the
all.
choices are limited. Absolutely. Yeah, I see.
And therefore,
I see
the
that.
learning will happen here. And if Africa's clever, it will own the learning
Right.
that comes from its own
Right.
people.
Right. So then in that case, I think if AI can be tailored for the African audience, I think then we'll be moving in the right direction in that case.
Right.
Because currently, obviously, especially when it comes to open AI, we see a lot of people saying that, content is very much tailored to the Western world compared to Africa. But recently at an event I attended, I did hear that now people are even looking into coming up with AI platforms that have almost all African languages. So I think we are moving in the right direction when it comes to this. So if we go into AI, I know that we will dominate the whole conversation. So, Mark, if you could leave our listeners with one key takeaway specifically about Africa's role in global health, what would that be?
I would say that African governments, like other governments, need to rethink how they classify health spending. Prevention spending ought to be looked at the same way as spending on ports or infrastructure or roads or broadband,
Right?
Because it's building the workforce for the future. 1 in 2 babies born by the year 2100 will be African. So Africa has a demographic strength that the rest of the world doesn't. We in almost all of the rest of the world, we're having to think about how to deal with very fast aging societies. Africa has that to a lesser extent, right? To get the full benefit of its demographic bonus, Africa needs to keep people in their 50s and 60s working, as well as having all those young people coming into the workforce, so that it can get the maximum bonus. So I would say prevention spending is an absolute no-brainer. You look at it the same way as spending on a new bridge. Treatment spending is a bit more difficult, and there's clearly human values of treating people because every life deserves respect and honoring. But then there's an economic calculation about how do you prioritize treatment to maximize benefits for the economy. What I would say is that in the whole world, what we see is that people over 55 or so are far bigger drivers of economic activity than people under 55.
Yeah.
That's because they tend to have paid for their children to go to college. They've bought the house. They've done whatever, and therefore they spend more of their disposable income. So keeping people over 55 healthy is a sound economic decision. And I would say, so the one thing I would say is start thinking about health not as a drain on the economy, not as something that you pay for that disappears, but as spending that actually builds prosperity. Absolutely.
That's a very strong way to end, Mark. And I totally do agree on that. And that's something that I think our listeners will have a lot to think about from this conversation. So thank you very much. It's been such a lovely and valuable conversation. And we will definitely be thinking about this conversation for a while to see how we can move Africa ahead, especially when it comes to its link to global health. So thank you so much to our listeners as well for tuning in. This has been Voices in African Health. Be sure to follow us on Podbean, Spotify, or Apple Podcasts so that you don't miss future episodes. Until next time.